Hello, everyone, and welcome to AceOSCE's case for today. AceOSCE is our organization that helps you pass the OSCE, giving you tips and tricks to use your resources to the best in order to pass the exam in your first attempt. Today, we're doing such a mock test. When you stand outside your OSCE door today, you see the following note. You are working in your regular pharmacy and your patient comes to you with a prescription. Do as you would in your regular practice. Keep in mind, you have 7 minutes to complete this case. You have 20 seconds to go through the reference as well as the patient's profile that you've been given on your OSCE station. You will be given a 2-minute bell when there'll only be 2 minutes left out of the 7 minutes to complete your station. So make sure to not be nervous and use your time wisely. Once the patient comes in, you greet her and ask her to have a seat. You double check with her as to what her concern today is and ask her for her name and date of birth to confirm that the profile you have on the table matches that with the patient. Once those are done, you can go onto the patient profile and ask her the questions she has. Upon looking at your table, you see that this is Mrs. Sandra Jones. She's a female who's 70 years of age. She seems to be having no drug allergies recorded, and the only chronic condition she has is asthma. Her current medication list is in front of you, and today she has presented a new prescription for the pneumovax vaccine to you. Upon asking, she has the following questions. I already got my C13 vaccine before, a few months ago. The doctor now gives me another pneumonia vaccine. Do I even need it? On seeing that she has this question, you ask her if she has any further questions for you. She does say that she has one more question. If I got that vaccine today, is it okay or do I need to wait? In order to answer these questions for her, you ask her for some time and you need to go through her profile to make sure what you see is the most current information you have. Don't forget to ask her the dosams, any other drugs she's taking, any new allergies she's developed, any side effects from the current therapy, any other medication she's taking. Once she replies to you that she isn't, and you're satisfied with her answer, go into the reference and ask her to give you a few minutes so that you can go into your reference and answer your questions. Try to use your reference to answer most of her questions. Try not to use any of your knowledge that you have previously, just because it may be outdated and may not be the answer the assessor is looking for. Upon reviewing your reference here, you see that for patients who are over 65 years of age, in which Mrs. Jones does fall in, the pneumonia C23 vaccine is recommended for all patients over 65 years of age, and she does qualify for that, which answers your first question, which you can let her know. In the same way, as I have told you, you can just tell her that being over 65 years of age, even after getting the first vaccine, you are eligible and recommended to get the second vaccine for which you have a new prescription for. After, you can go down and you can see that the pneumonia C23 vaccine should only be given 1 year after the C13, as she is a normal patient, she's not immunocompromised, she's immunocompetent. You can let her know that she's not due for her C23, as she only got her C13 8 months ago, and she does need to wait for 4 months to get her next vaccine. This should answer most of her questions, and you can again ask if she has any questions. If not, you can end the case by thanking her for coming to your pharmacy and asking her to give you a call if she has any further questions in the future. All the best.